Hiya, what's the crack? It's Erin. I'm sorry that it's been a wee minute since I've updated you. Since I got my diagnosis, it's been like a rough almost 2 weeks, I think, of just like processing everything. I've had good days and bad days, and days where I was feeling grand and I don't want to come on and talk about it because I don't want a bad day, if that makes sense. But I have a lot of information that I'm packing into this video, so just prepare yourself. I'm just going to explain everything that's happened to me over the last 2 weeks. So let's start with the diagnosis. My neurosurgeon's office only calls me on a Tuesday or a Thursday, and they're always closed every Friday. So when I got a call on a Friday from a no caller ID, I never expected it to be my neurosurgeon, which of course it was. And he was doing the very, very kind thing of picking up his phone and letting me know as soon as he could that there had been a diagnosis. And so he was calling me because pathology rang him to let him know that there was a diagnosis, which usually doesn't happen. And he said that only happened because they knew that the whole hospital has been upset waiting, you know, it was a long 79 days. And so how he laid it out to me was, your tumour first went to London where they're experts and they couldn't diagnose it. Then it went to Toronto, and it actually went to the world's biggest children's hospital, which is also one of the world's like leading neuropathology hospitals. I think that's the words he used. And so they didn't feel comfortable either diagnosing it. And so what they did is they came up with this really long, like kind of vague name, which is a diffuse low-grade glioma with a braf mutation. With that being said, they said it's grade 2, and they said that they don't know if it's benign or malignant right now. So he didn't have too much information. Again, he was just giving me the call, which was so very nice of him, especially on a Friday. And so then I was referred to the cancer clinic. Teddy is demanding to join us right now, as usual. So I had my 3-month MRI, and I was really nervous, but I ended up having an interaction at the hospital with a lovely, lovely lady that works there. And she said that she's been following on my journey on here, and that really helped take my mind off the stress that I was having about getting the actual MRI done. So that was really lovely. So then we went home then and waited to get our cancer clinic appointment. When I went into the cancer clinic, that was really scary, to be honest. It was grand, you know, everyone in there was so incredibly nice, really, really lovely people. I was the youngest person in there by far, which was a wee bit scary. Not that it matters what age you go through this, but it's like, it's just kind of hard being 26 and, you know, everyone else being at least 30 years older than me that was in there. So that was a wee bit tough. So the appointment was 2 hours long, and it was a pretty rough appointment. They were so incredibly nice, but it was just hard to hear. They said that mine's is grade 2, right, out of the 4 grades for glioma, which is not the worst news. But with grade 2, they normally go ahead with the radiation and chemo. And chemo is only ever done to make sure the radiation is working properly, is what he said. But with getting radiation on your brain, you can only ever get it once, and it can also leave behind some damage. With me being 26 and with the reoccurrence rates of gliomas being incredibly high, they said that they didn't want to use my one chance of getting radiation now because I'm going to need it later. And they didn't want to leave like any brain damage behind basically from getting the radiation done when I'm 26 years old. And obviously he was saying like, we hope that you're the rare case, like you're the one that doesn't need it and all that kind of stuff, but it's just really, really not great. He said that, you know, within 5 years, like his patients that have like low-grade gliomas, over 50% of them have their next one within the next 5 years. And the average amount of time that they live from getting their first one out is 10 to 15 years. Which is just really hard to hear when you're 26. So what he said was, the next one that you get is probably going to be grade 2 again, which we're hoping for, like probably it's going to be, but then your next one will be grade 3. And just the thought of having to go through all this again is just really hard, and the thought that it's just going to keep coming back. And once it gets to grade 3, things just like accelerate super fast. There's medication for the braf mutation, which is great. I've been looking into it, and I'm being referred on to another oncologist now in that cancer clinic. I haven't got the appointment yet, but I'm supposed to have an appointment with them to discuss if they want me to go on them now or wait until my next one comes back or anything like that. So that's coming up soon, hopefully. Sorry, my camera just died and I've had a wee bit of time to, you know, recenter myself and be grateful for everything I have and not get too upset about what I just told you. So I'm gonna jump back into it. They gave me a vague name, but there's multiple types of glioma, right? And they just don't know which type mine is. So they're giving me like the low grade glioma, but in terms of treatment and all the statistics they gave me, that was all on like a generalized all the low grade gliomas, if that makes sense. When I was at the cancer clinic, they asked me, when was the last time your blood was taken to check the levels of your anti-seizure tablets? And I said, well, not since they first gave them to me back in October. They took my blood like a week later. And she was very like, what? You know, what do you mean? She was like, the next time you talk to your surgeon, you need to let him know. So I had a call with him the next day and I told him that that's what they said. And he was like, okay, you need to go get your blood tested like today, basically. And so I did. I went for my blood work and I was thinking to myself, you know, I've had all these weird things with taking these tablets. Like my eyes are super sensitive to light. When I take them, nothing comes up, but as I swallow them, it literally feels like acid, like I'm drinking acid as it goes down. So it hasn't been nice. And when I talked to my neurosurgeon about this, he was saying, you know, you should probably get your medication changed, but that would be through a neurologist. And it's a really long time to see them and it's nothing that we can really kind of do, so you just kind of have to get on with it. And I was like, yeah, that's fair. I have some side effects, but that's grand, you know, I'll persevere. I was saying to Devin, maybe my prescription is like too much. Maybe it's too high and that's why my eyes are super sensitive to light and I'm having like these weird side effects. And so I was really looking forward to getting the call to be like, we're cutting down your medication. But obviously that didn't happen. I got the call to say your levels are way too low. So the level was supposed to be 40 in my blood and mine was at 21, I believe. And so I needed to up my medication right away. And then I had to get my blood test done again a couple of days later. And so I'm still waiting for those results. But with upping my medication, my breathing has went all the way back to what it was before. So my breathing still hadn't went back to normal, right? Like even like on good days, today's not necessarily a good day, but I know me speaking, it's very hard to see me having breathing problems. Even on a good day where I didn't have like loads of pressure, if I try to take a deep breath, it would feel like I'm like stretching my lungs, like it just hurt, like they just wouldn't fill. But like with upping my medication, I've went all the way back where like my throat feels like restricted and it feels like I just have like a ton of bricks on my chest. Like it's just so like hard to breathe. It comes and goes in waves where it gets like a wee bit worse. Like I have like good days, bad days, but it took a million steps back with this medication. So if you've been following, you know that I have my heart ultrasound this week coming. I am 100% sure that that's going to be grand because I'm so confident that it's my medication that's the problem. And so I'm just a wee bit nervous because I know when I tell them that I'm not going to be able to go to a neurologist right away. And if they want me to up my medication again, I really feel like I couldn't. Like when I open my eyes in the morning, like my first thought is like, oh, the ton of bricks. Like it's just so, it just feels so uncomfortable to breathe. So I'll let you know how that goes and if I hear anything soon, so hopefully. So the next thing is that I want to go home. Obviously with this information, it's a lot, it's not great. I want to be around my friends and family. It was kind of lousy because my dad was here for literally like over 3 months, right? And he wanted to be here to get the news so that, you know, I had him here for support. He eventually had to go back, right? He had to go back to his life. He had to go back to work. He had a million things going on. And I was like, you need to leave because I'm feeling guilty that we're just kind of sitting around and there's been no news. And so he left on a Monday and I got the call with my results on the Friday. So that was poor timing, but I would like to get back home. I miss everyone, I miss being home, and so that's really priority right now. That being said, Devin is trying to apply for his visa, which is really expensive. So we're in that. We want to take the dog and the wee bun with us, and the wee bun is crazy expensive to take home. So right now we're just trying to save for those things to be able to afford to go. And also I want to take my tumour back with me. Not that I have any doubt whatsoever in like the work that they've done here. They've done a great job, but obviously I just want to get a second opinion. Like I want to be sure that it's not good news, and you know, you never know, they might be able to figure out what type of glioma. Like I just want to see what happens, right? I gave the hospital a call and I asked about taking it with me, and they said that legally it's our property. I never expected that, to be honest. You know, it literally came out of my head. But okay, I'm in the process with the lovely lady I was chatting to at the hospital in trying to figure out a way that I'll be allowed to take some of it with me. She did say that they have like blocks and they have like slides, and it will be a lot easier if I just kind of request slides. That being said, I'll have to come back to Canada to give them back because they're theirs. My dad has an appointment with the hospital at home on Monday, and he's gonna FaceTime me during that appointment. It's with a couple of doctors and oncologist, and they're just gonna kind of go through, you know, treatment and options and how we're going to go about requesting getting it from over here. So like I said, the lady I talked to was really lovely, and she gave me all like the fax information and all that kind of stuff, and was definitely like trying to figure out a way that I could get it. So I really appreciated that. But that is where we're at. Also, I've been here for almost 3 years and I've accumulated like so much stuff. We've been living in this wee flat now for over 2 years, and obviously we're super comfortable, and we were planning on being here for at least 2 more. So we have a lot of stuff that we're trying to get through. I've donated literally more than half my clothes, and we're just kind of trying to slowly but surely like clear things out, and it's just hard not having a date in mind, right? But the plan is that my dad is going to come back over, be here to help us get ready to go home. It would be nice to have an extra person just for the travel with the animals and to help us kind of pack things up too. So I doubt he ever thought that he'd be coming back, especially so soon, but I appreciate that. So that is pretty much everything that has happened in the last 2 weeks, which has been a lot. It's been a lot to process, so I'm sorry that it's taken me a minute to upload this. As always, like I say every single time, I appreciate you all so much. Every comment, every message that I get on Instagram has been so lovely. As of right now, every single day is just me trying to stay on the positive path. You know, there's ups and downs, and it's a lot to process. It's a really hard thing to be going through. So if you're also in this situation, it's completely normal to have good days and bad days. It's normal to, you know, sit in, close the blinds and just cry for the whole day. It's completely normal. And then for the next day to feel like, oh, everything's grand, and want to go out and get a coffee and take the dog a walk and stuff like that. So that's where I'm at anyway. So if you're also experiencing that, please send me a wee message on Instagram so that we can have a chat. I've talked to a lot of really lovely people who are also going through this journey as well, and I would really like to connect yous. I've had such a nice group of people that I'm talking to, and I feel like for a lot of them I'm the only person in a similar situation as them. So my mind right now is trying to like figure out the easiest way to connect all of yous as well. So if that's something that you're interested in, send me a wee message on Instagram too, and I'll figure it out. So I thank you so much as always, and I appreciate every single prayer. I appreciate everyone that's out there manifesting and sending all the good vibes. I really appreciate it. I will let you know how things go in terms of my heart and in terms of my medication. My MRI was good, by the way, I forgot to mention that. So that's good, so that's great. And thank you very much for getting to the end of this video. I really appreciate you all as always, and I will see you next time. Bye bye.